Welcome to another episode of Behind the Needle. Today we are here with Brittany Bunjovac. Did I say it right?
You did
I
say
know,
it correct.
I know I said it right.
Yeah.
I know I said it right. Bunjovac is what she goes by. That's the American way of saying it. But Brittany owns BBUN Beauty, Aesthetics, and Wellness.
BBUN Beauty, Injectables, and Wellness.
Injectables and Wellness.
You got it. It's all good. Close enough.
We're calling it BBUN for short, not Bun B. But a lot of B's we're throwing around here.
Yeah,
I'm excited. Brittany, you're out in Norterra, which is North Phoenix.
that's correct. Yeah.
Made it all the way down here to Scottsdale
Yes.
for the episode. Thank you for
Yes.
coming in. I'm excited to interview with you today because I feel like what you're talking about on your social, which is where I found you on Instagram, is you're leaning really heavily into wellness.
Yeah.
So we're gonna focus a lot on that. We're gonna kind of define what
Okay.
wellness is. And your space that you're creating and holding for your patients and why you're doing what you're doing.
Yeah.
Before we get into that, can you give us a brief explanation of kind of how you got into where you are? You told me before we started recording that you have been in aesthetics since 2014 and you have been running BBUN since 2021. So you've been doing this for a while.
Yes.
And I also asked you, did you always know that you wanted to go out on your own and own your own thing? And you were like, absolutely.
Yeah.
So kind of give me a background. How did you get into aesthetics in 2014 and then take us to where we're at today?
So without, telling you too much of my life.
Tell me everything.
Okay.
Tell me everything.
So I knew that I wanted to be in medicine since I was a little girl. I was the kid that was protesting school lunches. I told my mom and dad I wanted to be a doctor.
Why were you
So-
protesting school lunches?
Because they were catastrophically awful for kids in nutrition,
How did you know that?
based on how I felt. And I
Really?
know that sounds crazy, but
No, it doesn't.
I've been very in touch with my relationship with food since I was a young girl.
Yeah.
I mean, my mom says she recalls when I was 4 or 5 years old telling her, watching the news and seeing reports of salmonella and telling my mom, I'm not eating Jack in a Box.
Yeah.
I'm not eating that, Mom and Dad. And for a while I was vegetarian, where my family, hardcore athletes, hardcore opposite, hardcore meat carnivore people. So it was very young that I kind of started building my relationship with food, and understanding directly how I ate was how I was going to feel.
That's fascinating.
Yeah. And my dad was he very much preached, eat like it matters. We were all in sports or extracurricular activities, and he was like, soup is not food. You need to think of your body as a gas tank. So what you're putting in matters. And if you want to last the whole day, you're not eating a Laffy Taffy and soup. What are you putting in your body? So very young, those words were preached to me. And I felt that when I would eat poorly, that I would feel like crap.
Wow.
So it's not that, I was perfect or our family was perfect. I come from a family of very hard workers, but
There was some
so
Laffy Taffy
there
with
was some
soup
Laffy
days.
Taffy. There was some McDonald's dinners in the car for baseball and soccer, but ultimately I just knew from a very young age that what I ate mattered and how I
Okay.
would look, how I would feel. So, long story short, I knew I wanted to be in medicine. I knew I wanted to be in wellness. I just wasn't quite sure, but my elementary school was awesome. They allowed me to protest the school lunches, and
How did you protest them?
I literally went around school and had students that felt the same as me sign a Excel printout that I printed out in tech classroom. I went to multiple teachers and asked them if they felt the same way, that our school lunches could improve.
And how old were you?
Oh God. Then I was 10.
Wow.
Yeah.
Okay.
Yeah. And I tried to take it as far as I could. And my principal, Dr. Gundrum, was so good to me. Instead of meeting me with resistance, he wanted to talk about it. And he was just like, listen, the school district is bound by the food pyramid and funding and what we can, maximize out of that funding. And this is what we embrace when it comes to your school lunches. And I had the utmost respect for him, but I did not respect that answer. I was like, this is just not right. So eventually school lunches improved. We got the salad bar, and I will not say it's just because of me, because it took a lot of adult effort. But from a very young age, I knew that, I wanted to see change. And I feel like, that was kind of like, all right, I know I'm going to go in medicine. But as I grew older and learned that medicine, health, and healthcare are not the same conversation, I realized that I wanted to do my own thing and open up my own practice and care for people at the level that I believed in was effective, as opposed to being in the hospital. I wanted to go into more preventative medicine. So before I got into preventative medicine, I've always been in touch with making my skin look and feel the best.
Yep.
And I, once I got out of high school, started kind of making money. I was going to an esthetician and eventually an injector. And this injector she was awesome. She was like, hey, why don't you give nose filler a try? And I was like, nose filler. Okay. Even bridge. I got a Yugoslavia nose, and having that uneven bridge and her telling me I could make it more even. I was like, sounds good. I had no idea. At this point, I was like, I trust her. She's great. Let's do this. And I had a complication with my filler, and I had no idea what was going on. I just know I was in pain and I was in discomfort.
Well,
and
nose filler complication is not the area you want to have a complication.
Correct.
You don't want it anywhere, but not in the nose.
For those that don't know, injecting the nose is an extremely high risk area. Personally, as confident as I am in injectables and as much training as I've had, I can very confidently tell you that I would never inject someone's nose because of the vascularity, the anatomy differences, and just the risk. It's a very high risk area.
Crazy, right?
Yeah, it is crazy. So, but I didn't know, and so I was injected with filler, and I very quickly had a complication. I didn't personally know what was going on. I just knew I was in pain. My skin was discoloring, and
oh my word.
Yeah, and the filler was moving to like the top of my eyelid. So I was like, this is just not right. And I reported it back to the injector, and she told me it will find a home. Just allow your swelling to go down, your pain to relax, and you'll be okay, basically. And it didn't feel right. You know when something's wrong, right? So on lunch, I'm Googling my symptoms, and, I found out that I was having a vascular occlusion.
Yeah.
In the very least, a vasoclench, right? So I eventually...
And for those that don't know, a vascular occlusion is...
quite literally a clot within your artery or a clench down on veins or vessels within that given area. So you don't have blood flow to that given area, which can just
Well,
cause
if it's
so
in your
many
nose,
issues.
it can cause blindness.
If it's within the top of your nose, around your dorsal artery, or within the center of your forehead, you absolutely can lose your vision. And it's a very short window to correct that.
Yep.
So Googling my symptoms, I realized that I was having a complication, found someone that could help me out with that complication. Thank heavens it was reversible and I was fine and on my merry way. But I thought to myself, how the heck can that happen and not everybody just know how to reverse it?
Or just to tell you that it's going to find a home. Well, it's going to find a home in a place that you don't want it to find.
Or your skin's going to necrose, turn black, and we have an emergency here.
Yeah.
So, kind of given
That's
my
crazy.
background, kind of given what happened, I became absolutely obsessed with injectables. And mind you, I was working a full-on corporate job, had a career. I always knew that I wanted to go into medicine, but I had to work to pay for school. I was working in private education, Motorcycle Mechanics Institute. I was basically a student advisor.
Okay.
Yeah, so had a great career, all was well, but I wasn't happy. I knew I wanted more. And, coming up from 2008 to 2014, I mean, the economy wasn't great. So no one was paying my tuition. I was. So I had to work while waiting to get into nursing school. So anywho, I became obsessed with injectables. I mean, every lunch I was shutting my door and watching YouTube videos and learning whatever I could. I was getting my brain in it before I was getting my hands in it years before I became an RN or was an injector. And I was very lucky that when that little beast BBUN was born, that people were very supportive of me. Doctors, nurses, jobs where I was at the front desk in aesthetics, all the way to selling aesthetics and then eventually becoming an RN, balancing a traditional nursing job, earning some experience while also training injectables. So I was just full speed ahead at that point once I became obsessed and realized that my favorite saying in the world and what I stand by, aesthetics is medicine. So when you start really realizing what you're putting into people and how it affects the human body, you can't dismiss the science. You can't dismiss how much of it affects so many other systems, right? Or what you're jeopardizing if you don't know how to manage that complication.
Right.
So that is kind of how both worlds collided. And then just with me always being into health, fitness, movement, making it count when you eat, I knew I wanted to be a nurse practitioner because I wanted that autonomy to treat patients holistically. And when you talk about the definition of wellness for me, that's really what it is I have a patient in my chair and he or she may very well be there for Botox, but if I notice that your skin, you know, is extremely dry. It's not just poor skincare sometimes. It's not just, you know, the climate of Arizona we live in. It could be perimenopause. It can be menopause. It could be, you know, something else going on that's an illness. Your skin is your largest organ, right?
Yeah.
So if I have that in my care, it's something you acknowledge. It is treating the patient holistically. And then you open up a conversation for so many treatment options that I wanted to be able to offer my patients. So when you say, what got you into this? My life,
The salad
my
bar.
life's work.
It was the salad bar.
Yeah, it was the salad bar. It was the salad bar in elementary school.
What was the name of the nurse that did your nose filler? I'm just joking. Don't answer that.
It wasn't a nurse. It was a PA, but she's wonderful and it
I'm just
happens
joking.
and we all learn.
I know. I'm just joking.
Yeah.
This is fascinating. And I think that, so we were just watching, my 4-year-old and I were watching an episode of Bluey yesterday.
Okay.
And I actually loved that show.
Yeah.
It was a really long episode. Most of them are like 7 or 8 minutes, but this one was like half an hour. And the family is selling their house.
Okay.
And Bluey, the main girl, is mad that they're moving and nobody wants to. And she goes to school and tells her class and everybody's shocked. And so the teacher reads a book called The Farmer. And basically in the story, the farmer has something happen and the neighbors come over and say, "Oh, what good luck." And then the farmer says, "Oh, we'll see." And then something happened as a result of that. And then it was bad luck. And he said, "Oh, we'll see."
Yeah.
And it just keeps going back and forth. And the moral of that story, because it doesn't really finish with like a good or a bad ending, the moral of the story is everything that happens has an output.
Yes.
And an effect on what we're doing in our lives. And it could be a good thing. It could be a bad thing. What's interesting to me is that your vascular occlusion that was happening led you to do aesthetics.
Yeah.
In a
My career,
very
my
strong
dream.
way.
Yeah.
And you didn't really know what you wanted to do in medicine before that, right?
Yeah, I actually fell out of love with medicine. I graduated high school 3 years. I wanted out of high school the moment I was in there for no other reason than I wanted to go to college so badly. I wanted a career so badly. My dad and mom always joked around that I was 15 going on 30 for my mindset and what I wanted. And I mean, it is what it is. That's how I was very young, as I knew I wanted to own a business of some sorts. I wanted to go into medicine. I just wasn't sure what.
Yeah.
But I graduated high school in 3 years because I got accepted into a junior's nursing program. Really cool in Arizona. They don't have it anymore, but it was a privilege to get accepted into this program. Basically, they hyper-accelerate you through a CNA program where you get to see the inside feels of what it's like to be a nurse. And not that it's not an amazing role, and my hat goes off to every single nurse in America, but for me, again, health, wellness, and healthcare are not the same conversation.
No.
And for what I wanted to do and what my purpose is and what I feel I was meant to do did not align with bedside nursing.
Yeah.
I appreciated my time. I appreciated my experience that I've earned through that, but it was never going to fill my cup for what I wanted to do.
You knew immediately that you didn't want to do it. You strike me as the type of person that has a very strong intuition and pays attention to it because you just know how it feels.
Yeah, for sure.
So you knew, and there's nothing wrong with that. There's nothing wrong with that being someone's life work, and that's their greatest passion.
Yeah.
I want you to kind of bridge this gap a little bit of you're starting to learn aesthetics, and nursing school. You had this childhood that you did and just rapidly growing mentally and it all tied together. And then when you found, and you're going through, and when did you do NP school?
I started, I've been out for a year, so 4 years ago.
Okay. And so you knew that you wanted to go to NP school. At some point you decided, oh, that's the path that I actually want to go.
Yep.
And so I've seen a lot of people talk about wellness.
Yeah.
Okay. Which is, it feels like, tell me if you agree, it feels like a very simplified word.
Yeah.
To kind of box together what is a very large, broad array of medicine and procedures and treatments, modalities, and practices that we can't really, I don't feel like we should just call it wellness, right? It doesn't feel like we're doing it justice. So this is why I kind of want you to define it if you can.
Yeah, absolutely.
So how does that work? And how is wellness different than aesthetics? Because they're not the same thing.
No.
But wellness is medicine. Aesthetics is medicine. So talk to me about that. How do you define wellness?
So for my specific definition, wellness to me is preventative medicine. You know, we look at your grandmas and your grandpas and look at all of the diseases that they were bound with. Those were preventable or at least more manageable disease processes that happened in their 30s. But our grandparents, our parents, and even our generation as well, we don't embrace going to the doctor every year. We don't embrace seeing a dentist every 6 months. We don't embrace wellness or preventative medicine as much as we should, in my opinion.
Is preventative catching it before it happens?
Correct. Or understanding that it could be worse, so prevent it from being worse, even if those genetics you're predisposed to that.
So it could be catching it early on.
Correct.
It's very much proactive instead of reactive.
Yes.
I've been doing this.
Yeah.
And I'm glad that it's common now. I'm not doing every test that I should, but I've been getting blood panels for 5 years. I just had a mole removed a week ago because the dermatologist said this one looks irregular, and we biopsied it, and it was a moderate risk.
Yeah.
It wasn't severe yet, and it wasn't melanoma, thankfully. But so I like that it's preventing it. So what do we do? How do we know what we're preventing? Like,
so
how do we know?
I mean, something as simple as, you know, visiting your PCP every year, or, you know, in my practice, preventative is really, hey, let's do a full blood panel.
Okay.
Let's kind of see what's going on beyond traditional markers in your PCP practice. And let's see what you're predisposed to. I mean, heart disease for men and women is one of the number one killers, one of the most catastrophic things on your entire body to deal with as far as disease process. And it is something that if you catch it early enough and know what you're up against, you can definitely, with lifestyle, you know, movement, food, control that. It's not that you're going to prevent, you know, that disease, but you're certainly going to be able to better manage it or potentially prevent it from going to that next level or in taking medication. I don't want my patients to take medication if they don't have to. Obviously, there's a time and a place for medication when it's appropriate, but that means that we've exhausted every single option from lifestyle, food, movement, you know, working out, what have you, supplementation before we go down the medication route. So that is what wellness or functional or, you know, preventative medicine is to me, is just knowing what we're up against in this lifetime, knowing what the controllables are, and exhausting every single option naturally before we go into treatment options, medications. Specifically, when we talk about heart disease, statin therapies. Statin therapy is one of the number one prescribed medications within the United States because of how prevalent, you know, hypertension is, high cholesterol is, the three type 2 diabetes or type 1. It's just, there's so much that once you're on one medication, it goes into 3 or 4 more. And by the guidelines of care, if someone's cholesterol is out of control and I am prescribing them statin therapy, you would almost bet your year's salary that 2 more medications follow that. So before we get to that point, what are we doing to prevent that?
I went and I don't even remember why I went to the doctor. It was a routine thing. It was literally nothing.
Yeah.
And I just needed to go get medicine. Oh, I had a cold sore. That's what it was. I had a cold sore and I wanted to get some medication. I did. And the tech, the MA, just came and took my blood pressure and said 140 over 80. And I was like, 140 over 80? I don't remember ever hearing that number in my life, that high. I was like, is that high? She's like, yeah, that's high. I was like, oh, okay.
Were you nervous?
So I Googled it, and then I was like, oh, I'm in stage 2 hypertension right now.
Yeah.
So I was nervous.
Yeah.
But I wasn't nervous before she took it. At least I didn't think I was. So the NP or PA, whatever it was, came in, and I said, hey, would you mind taking my blood pressure again? This is 10 minutes later.
Yeah.
I was already down to 130, which is still phase 1 hypertension. 120/80 is perfect for someone my age. And so it scared me, but I had just met him, and he was already trying to round third and come home and talking to me about medication and doing all these tests for coronary something or other. Yeah. And I'm like, bro, I don't know you. I don't know what you're telling me right now. Yeah. It was scary. So I bought a at-home blood pressure cuff, and it's the same one that a lot of people use in their clinic. So I know it's good. And I, for a month, would regularly test, and it was, within a couple of days, it was back to normal. Yep. And it stayed normal, and it's actually gone below 120/80. It's like 115, 112 sometimes. Yeah. Which is great. So I'm bringing this up because the traditional way of going to a PCP feels, to me, very cookie cutter, churn and burn. How many people can I get in my rooms to make as much money as I can? Yeah, absolutely. And I hate it. Yeah. And, I will say, because there's a lot of negativity in medicine right now, but there's just so much more that we could focus on the positive. It's a pivotal time in medicine. It really is. You have so many nurse practitioners and doctors starting to say, this isn't quite working. We go to school and we're basically taught the philosophy that we can't save everyone, so how do we save the most? We have these guidelines of care. We have a patient come in, they're popping up 140/80. It's my job to keep you safe, to prevent heart attack, to prevent further cardiovascular events or disease process. So my brain is taught in school to get you on hypertensive medication, to get you on stent therapy, to get you, you know what I mean? Like there's just this, it's drilled into your head in school. But once you get out and for me, it was younger because of what I was exposed to and how I wanted to feel. But if you don't know any better and you don't have experience with patients outside of the grid that's drilled into our mind, you just don't know until you know. So right now you're seeing a really powerful, cool thing happen in medicine where providers are saying, this isn't right. This might be white coat syndrome. We might want to take a few more blood pressures. We might want to send him home with a blood pressure log. We might want to send him out for further exams before we just throw medication down his throat. So a lot of that is happening in a positive sense. But to your point, yes, there's still those grid-like mentality providers that you're walking in, you're getting that BP, and you get a couple readings, and guess what? You have, hypertension. We got to get you on meds or whatever. So I acknowledge that, but I think that it's just really cool to be in medicine right now. It's such a privilege because things are changing. You're seeing movement and momentum. Well, they're changing because of people like you.
Absolutely. Mm-hmm.
Because I'm assuming your clinic doesn't churn and burn people.
Absolutely not.
So you take your time with the consultation. You actually, if you want it, to me, what you said is the right philosophy. You're not going to be able to save everybody, but
how do we save the most?
What is the definition of saving someone then?
Yeah, right?
Like, are you saving someone
and that's the divine question.
Yeah, that really is it.
Yeah.
Are you saving someone by throwing them on hypertension medication?
No.
No.
You're not fixing the root, rather. You might be helping a little bit, but are you really fixing the root cause of what's going on? No. Did you have a nutrition conversation? No. Did you have a movement or fitness conversation? No. A lifestyle conversation? I mean, there's just mental health conversation. It's a lot. Yeah, for sure.
You're having to break the mold of what you're taught, though, in the system.
Absolutely.
Because there's no other way around it. If you're taught one way about getting people in as quickly as possible, and it's why MAs exist, right? The medical assistants that bring you in and do your vitals and
God bless them,
ask those questions and everything, like they're there because you can have 2 or 3 of them, and then you just bop around to every single room, and you made $4,000 that hour because of all the visits that were there. Yeah. That's a lot of money.
Maybe for some models, yeah. It doesn't work in our practice that way. I very much, I take your vitals. That's not as common for an NP, but
no, it's not.
I'm in there taking your vitals. I'm talking to you for sure.
And I think that that's better because if you're able to calm me down from the get-go, I'm going to have a better reading and normal. So talk to me kind of about somebody comes in, you said you do a full blood panel. I'm assuming it's a very large report.
Correct.
And you start looking at nutrition. You start talking about stress, lifestyle, sleep.
Absolutely.
Okay.
Extremely important.
So then once all of these things happen, walk me through what it's like working with you after.
So after, you're kind of given a few tiers of options. We have like, we're going to full blown optimize from, sometimes medications, peptides. Then we have the more natural route where it's going to be supplementation. And then we just have people that, they're managing their disease and they need to be referred out beyond what my scope or comfortability is, and they want collaborative care. A nurse's oath at the end of the day, nurse and nurse practitioners, we are patient advocates. It is our job to advocate for the best option for a patient. And I take that with a lot of pride. So I have a lot of patients that once they do get a full-blown panel with me, it's not that I'm managing every facet of their care. I am collaborating care or managing care with them. I have a lot of post-cancer patients. I have a lot of patients that are battling a lot of autoimmune disease that they don't just fit in the functional realm or what I, specialize in. So collaborative care is actually a big part of my practice, especially being very young within my nurse practitioner career. I acknowledge that I am still earning skin in the game. I'm definitely still learning so much. And I think that it is such an important piece of patients' care within the United States that these PCPs or these functional providers are willing to collaborate care with other providers outside of their scope.
Yeah.
I'm not an oncologist. I'm not a rheumatologist. I need to acknowledge those things and see what I can learn while I'm helping co-manage that patient's care. So that's a pretty big part of my practice is, that collaborative side. And then absolutely movement, nutrition, wellness with the supplements. And then right now, peptides are a big craze. They've been around forever, but they're now they're at the highlight of a lot of, what patients want. So doing that safely through a 503 compounding pharmacy and managing how that patient is taking that peptide. It's a very scary time in the peptide world. I love knowledge, and I think that the way that people are getting it is fine, but I think the way that we're utilizing it is poor. You have to be able to anticipate unexpected outcomes with peptides, and you're not going to do that from your cousin's friend's sister on TikTok. You really do need a provider to help manage your care.
I heard that you can actually buy peptides online, like
Quite
real
literally.
ones.
Link in bio, baby. Swipe up. It's everywhere.
That's
it's everywhere.
crazy.
Yeah. I think if you talk to any of my peers right now, that's probably our greatest pain at this moment.
I mean, think about this. Should you go buy painkillers from someone on TikTok Shop?
No.
You can't, I don't think.
Who knows?
Maybe. But
TikTok's the wild
But you
west.
shouldn't be able to do that with medicine.
Correct. Yeah.
Like supplements are different because they're just so lower level. It's like not.
Well, the risk factor, right? The risk reward factor. It's not as great of a risk.
Right.
Although there are still, risks within supplements, but not as bad as injecting something.
Right. It's like buy my creatine monohydrate versus buy my peptide stack, my Wolverine stack,
Correct.
right?
Yeah.
So be careful.
Yeah.
Be careful with what you're doing. Realize that someone telling you something is making money off of sharing it.
Yeah.
And you don't actually know if you need what they're saying or not unless you have someone that you trust give you a real blood panel with your real data.
Yeah. And just, even if you took out all of the provider steps, anaphylaxis, going into anaphylactic shock and not understanding how to manage that. And that's a matter of life and death. Like your throat closes, you can't breathe, you're having a reaction to that. You're home alone filming your next post on TikTok. Who's going to save you? Who's going to help manage your care? And yes, arguably a provider's not right there, but if you have a provider educating you on what to expect and how to anticipate if certain things happen or doing your first injection with a provider, you cut that risk.
Yeah.
Again, risks versus reward. Is it worth it to save $30 on a peptide stack because you got it from your cousin's friend's uncle, but then you have an emergency situation arise and don't know what to do because no one forewarned you about that? Or you inject too deep because you don't know what syringe is proper or where to inject. It's just, or what's really in that peptide. Or if
you actually are getting a real peptide or a real Botox,
I think,
formula or whatever.
Yeah, I think right now people are very anti-FDA, anti what's approved. And I argue, take a step back and understand that, yes, I acknowledge that the FDA doesn't necessarily have all their ducks in a row, but that doesn't mean that there aren't steps for safety. And we would want to still get peptides that are regulated by 503 pharmacies, because they still have to adhere to safety standards that are partly regulated by the FDA, the testing standards. So I hear everybody, and I hear loud and clear my biohackers and my Joe Rogan podcast fans, including my own beloved husband, but there are reasons that there are certain safety parameters, and we should embrace those as much as we don't agree with the way the world is right now.
Yeah.
I hear both sides, but safety is the key.
It feels like going into an infrared sauna for 15 minutes a day is a lot different than injecting things into your carbon-based body.
Yeah. Yep. Yeah, for sure.
So this is all very helpful. I'm glad that you talked about it.
Mm-hmm.
I think it's really important for people to grasp, because we believe the first thing that we hear oftentimes. And so I hope that this is the first thing people hear when they're thinking about peptides or other medication, and just that they can inject at home.
Yeah.
Because they need to have someone who cares and knows what they're doing.
Yeah.
And, you don't know everything. No one that you refer out or that you collab care with knows everything either.
It's impossible.
But that's the point, is that when you're doing things responsibly and with the patient in mind, you're trying to save them. That's how you mitigate or lessen the risk overall.
Absolutely.
That's the safest way available of doing it, is under the care of someone who knows.
Yeah, absolutely.
Do you like wellness more than aesthetics now?
I think my favorite thing right now, and we didn't really talk much about this, but I think my true passion is hormone optimization. I think if I had to predict...
We can talk about it.
I think, well, we should, because
Let's talk about it.
It's amazing. It's pivotal, and it's, it goes... I was trying to battle my wanting to talk about it with the heart disease, but...
What is hormone optimization?
So obviously we have hormones from the top of our head down to our toes as far as the receptors go. And, what pops up in traditional labs within guidelines of care is not optimized. It's not normal for you. You have a bell curve, and here's the lower part of the bell curve, here's the middle, and here's the, the end. Why would you settle down here if symptomatically you're feeling like crap? Yeah. Why wouldn't I want you into the middle or to the highest portion of the bell curve? So course. That to me is optimization, is is hearing your symptoms, treating my patient holistically, and truly optimizing those hormones to be to the best of their ability. I cannot explain to you, I've always been a pretty sharp gal. I don't know everything, but I absolutely love school, and I've always kind of attributed how sharp my brain is to school, as being able to remember and test, right? And in my late 30s, my brain dramatically changed. Now, I'd argue I was putting a lot of stress on myself, running a business, going to school, training outside, training other RNs. I acknowledge that. But my brain changed, and I was like, I need to get a brain scan. I don't know what's going on. Oh, no, it could be my hormones. I know better. Take a step back. Nurse practitioners, we're the worst patients. We can preach all day and take care of people all day, but when it comes to ourselves, we neglect ourselves. So I'm like, I need to test my hormones. I need to see what's going on. And I had a 0.1 testosterone. And
oh my gosh.
Yeah. And, further levels in my testosterone and other levels were a little wonkadoodle.
And if people don't know what 0.1 means, I know.
It's next to nothing.
Well, there's different testosterone types.
Correct. Yeah. Free total. Yeah.
Yep. So, but a 0.1 and it's hard too, because the normal range is based off of data of other people. It's not necessarily how you will feel, right? So, but a 0.1 is terrible no matter who you are.
It's suffering, in my opinion. And that's exactly what I was doing. I was working out like a monster. I was, sleeping specifically. I was doing all the right things, but I wasn't able to hold on to muscle definition whatsoever.
Wow.
My cognitive function was it was declining, as if I had an illness. And I just was like, what is going on with me?
And what's the normal range though for that marker?
So here's kind of that conversation, right? Is like, everybody is different. I'm not going to expect someone even my age who doesn't work out to the level that I do or have the same day that I do to be adhered to a certain number. So
Okay.
it really just depends. And it's kind of part of my sauce is treating symptoms, piecing together lifestyle, meeting a patient where they're at, but also pushing them to where they could be. So, you know, I say if you don't have someone who's tested your hormones and talk to you about hormone optimizations and what those numbers should be, please do, because you would be so enlightened to learn what that really should look like. So for me, I'm a gal that's always going to naturally run on lower testosterone. I've been that way majority of my life, but that, you know, that doesn't mean that I have to suffer. So and because I was so young, people didn't want to treat me. They didn't want to put me on testosterone therapy. And I was like, nope, I have to push. I have to find someone who will do this because I believe in this and I know it'll work.
Are you on it now?
Absolutely. I'm on testosterone therapy and I've gone through the troches and now onto cream, about to do pellets. But, you know, it's been a road. And I think that that's a big part of what I offer is I've struggled. I've been in the trenches of hormones not being optimized, testosterone being our most, you know, prominent hormone, and realizing that it can affect everything, your mood. I mean, it's multifaceted as well, but my favorite thing with hormone optimization is just acknowledging how much it correlates to liver and cholesterol for men and women. You know, understanding where these hormones are truly recepted in the body and what organs they kind of play into. And you'll see a woman's liver, I see a lot of women's livers tend to start to be sluggish. I see a lot of cholesterol rising, you know, and then it's funny that testosterone's changing, that progesterone's changing. Estrogen might hang on for a little bit, you know, 1, 2, 3 might chill out for a little bit, but then you're seeing all this change. And it's amazing to see that liver number come down, that cholesterol number come down, that testosterone number come up. Wow. And symptomatically, someone feels as if you've changed their life. And it's, you know, low-hanging fruit, ladies and gentlemen. Like, get your hormones optimized. We deserve that.
And a blood panel to figure all this stuff out, a couple $100.
Yeah. Mm-hmm. I go through insurance if I can, and cash pay labs, you know, it's a big panel. It's not something you're getting with your primary care. So you're looking around $575 for a full panel, but that includes time with me, 45 minutes, reading your blood work, going over what your options are, and next steps to our relationship of making you feel your best, right?
Yeah.
So, but you know, not to go on a tangent, but the coolest thing that I feel like is going on in medicine right now is we women, as much as we thought those firsts were over for our grandmothers, they're not. You know, we're seeing that there's a lot more funding going into women's health. There's changes in our diagnoses, and you are going to see in our lifetime that women are going to be optimized with their hormones. We're not just here to procreate, serve our husbands and the man, and then, you know, die. Like, our brains are to be maintained, our libido, our muscle tone. I mean, it's so cool because that is what I feel like hit me. And I was like, that's what I'm meant to do is help women and men with their hormones. So to kind of go back to your question of, is that my favorite thing right now? I don't think there's a world where Brittany Bunjovac and aesthetics treatments don't exist, because I love it so much. And I consider myself decent at it, good at it, love it. But I just can't dismiss this fire that people need hormone optimization. They need preventative care, and I'm going to do it as long as I can.
Based off of how you grew up and spearheading the overhaul of an entire district's menu as a 10-year-old, I would say that you're probably going to keep, this is just a guess, who knows, you'll lean into this very heavily, and it will overtake a lot of what you do with your time as for work rather. Yeah. Because you're the type of person that is just going to make sure that something happens. Yeah. You're going, you know, you're a catalyst, right?
Sure. Yeah. I like that.
I think so. You might not be the person in charge of making the change happen, but like, there has to be catalysts in order for change to happen. There have to be catalysts to get us in the aesthetics out of the wild, wild west phase that everybody likes to talk about that we're in. There has to be catalysts for that. There has to be catalysts for the FDA to approve as many peptides as possible. Like, There has to be.
Yeah.
Though, and there's not very many of those people.
Mm-mm.
There's not.
No.
I can tell you, like, I haven't interviewed a lot of catalysts, but you are.
Yeah.
So that's cool.
Thank you.
That's cool.
Trying.
So just keep using your voice and pushing things in the direction that everyone knows that they need to go, I guess is my encouragement. Yeah. I want you to kind of finalize the thought here about what you would say to somebody who, because the people who are listening to this are either going to be people that follow you or that follow me. Maybe they shared with someone that they know too, who's been thinking or talking about hormones. But what would you say to the woman or the man who notices that, oh, I have some cognitive decline here. I'm feeling sluggish. I'm feeling foggy. I know what I would say to them. I would say, hey, you don't have to feel that way. You don't have to suffer in silence. There are a lot of people that can help you, and Brittany is one of the people who can. Go talk to her. Just have a conversation and figure this out. You don't need to be afraid. You need to be brave, and you need to go actually figure it out. But is there any encouragement or words of advice that you would give to somebody who's been thinking about all of this?
Absolutely. I feel like every single day that I'm caring for people, I hear, but maybe I'm just being weak. Maybe I just should ignore it. Or I don't know if that's normal. I will tell you, your body is a magnificent system that we don't even fully understand. And it would be impossible to fully understand in our lifetime. But your symptoms are signals. And you want to report those signals, whether you feel that they're normal or not, or just question or have that, innate sense go off that like, this isn't right, but maybe it's just my new normal. It doesn't have to be your new normal. Every single symptom you feel that's off is a signal of what your body needs. Report those things to a provider that's truly listening.
Yeah.
I spend a minimum of 45 minutes with my patients. It is very often that it comes to an hour and 15, or 2 45-minute sessions. It's what's necessary. It really, and even then, I feel that, like, did we have enough time together? Did I get all the information? It's a puzzle for me, and that's what that provider relationship should be, is we are puzzle piecing your care. So you should feel equally able to communicate those symptoms to me as I am to care for you and solve it. So report anything going on. Food journal. What did you feel when you ate this? See if we can piece it together that it's a food allergy, or perhaps gut up. Just anything that you feel is not normal. Write it down. Report it to your provider, because it shouldn't be dismissed. And that is a part of optimization, is treating those symptoms and making you feel and look your best possible, from Botox to hormones. So just talk to your provider. Go to someone that's willing to listen.
Thank you.
You're welcome.
All we can do is say that.
Absolutely.
And hopefully through your story and mine, as mine develops, I'm going to keep talking about it too. People just have to take control. You have to like you talked before we started recording, you're a routine girl.
Yep. I live and die on routines.
You didn't get to work out this morning, which is step 1, but you have 2 through 5 still. And it's like, don't get so caught up in a routine that you can't do something else and just totally get derailed.
Correct.
You have to be able to say, okay, I'm going to pause what I normally do and I'm going to go check this out because there's something here. So I appreciate the conversation.
Yeah, same.
How do people get in touch with you?
So the easiest way to get a hold of me is www.bbunbeauty.com, where you can
bbunbeauty.com.
That's correct. You can explore our services, look at our providers, and you can hit the book now button and come see us for any of our services we offer.
Amazing.
Yeah.
Thank
including
you.
Consults.
Thank you.
Yeah, thank you.
I appreciate it. And thank you for listening. Until next time, take care of yourself, everybody.